Massage cupping can be a great addition to your practice. This is something that I learned about years ago with the traditional Chinese cupping, where they would use a glass cup, pour in some rubbing alcohol, light it on fire, throw out the alcohol, and then put the cup on the skin, and it would draw skin up in. The problem with that type of cupping is that it's potentially dangerous, and I have seen people that were burned with that. Some years ago they came out with plastic cups with a vacuum pump, and the cups can be placed on the skin, and then you can create a vacuum and that can be left on the skin, or with oil you can move it around some too and do cupping this way. And although this can work, it's a little cumbersome. What I've found recently that works very well are these clear silicone cups. And these are much easier to work with. You create the vacuum by catching the lip of the cup with your fingers, pressing it down. You can put it on the skin and then get a nice vacuum that way. And with the cupping, with this type of cup, you can easily adjust the amount of vacuum. And then once you have it on the skin with oil, you can move it around, lifting the skin. So this is very much like skin rolling. How's that feel, Lisa?
Good.
But it's a lot easier on the therapist and a lot more effective than the skin rolling. I like going all different directions with this. This works the superficial fascia underneath the skin, what Gil Hedley refers to as the wetsuit, a layer of fascia just underneath the skin, and helping to lift that off underlying muscle. I found working with this that as I'm working, sometimes in certain areas it will feel tight, it will be harder to move the cup. The more I work through that area, the easier the glide is as it works out the tension in the tissues. I find this is a really good prelude to deeper work with clients, as this relaxes that superficial layer of fascia, and then it allows me to get in deeper with my hands, forearms, knuckles, elbows later on. As you're doing this work, you can vary the amount of suction. I like starting out with mild to moderate suction. Then I can get deeper work by just having more suction to it. In the classes, they talk about the amount of lift you get there, that it can be like a mouse or it can be like a bear. But I find if you gradually progress with it, it's easier with the client rather than starting out with the most suction initially. Give some time for them to get used to it. There also are different size cups. Smaller ones like this can work very well, particularly if you're working, say, on the front of the calf or on the forearm. The very largest one I'll use on the back. A little too much suction there. What I find too, if there's difficulty moving, is I hold the skin with one hand and pull the cup with the other, like this. You can leave the cup in an area. They often do that with acupuncture, but that'll end up leaving a big red area like a large hickey afterwards. So generally I don't like doing that. I don't like sending clients home with big hickeys on them. So I like to keep the cups moving when I'm working. The area will be redder after you work just because of the increased circulation to the skin. There's also work you can do where you just lift the cup. You can press into an area and then just lift like that. That gets a nice lift to the tissues as well. Cupping also can be great for areas where there's scar tissue. My wife had had laparoscopic surgery and was unable to lie on her stomach because of scar tissue and pain. I was able to use the cupping with her over the abdominal area, just getting moderate suction, and I find here particularly that it's helpful to hold the skin with one hand while moving the cup with the other hand. If there's difficulty moving the cup, you can also turn the cup some as you move it. But I worked with her, generally going in a clockwise direction over the abdominal area. And after just one session with the cupping, she was able to lie face down and be comfortable, whereas she couldn't do that before. We'll increase the suction there. So this worked very well for the scar tissue with her. We ended up getting a set for at home so that she can do that for herself as well. I also have been working recently with a woman with breast cancer who had mastectomy, and with the scar from her surgery, she had a numbness and tightness around the area. So I was able to work with her with cupping all through the upper chest area, around the scar and around the surrounding tissues. And we're able to loosen up that scar tissue and loosen up the binding in the fascia, superficial fascia. And she found that it helped with the sensation. She had kind of a numb feeling to the area before, and with the cupping she found that the feeling was coming back. She also found that she was able to bring her arm up overhead, that she had better range of motion through the shoulder because she did not have the restriction through here with the skin and the underlying muscles. Cupping also can be used on fascial lines, on muscles as they're contracting, or I'll use it, for instance, on the IT band. The iliotibial band, you can find it pretty easy on the lateral side of the leg, and you can feel what way it moves, if it moves back and forth easily or where it's constricted, if it doesn't move forward as well or back. And so I'll work along the edges of the IT band. I felt more constriction moving this way, so I'd tend more to want to work on this back edge of the IT band, helping to get more mobility. So here I would use the smallest or the next to smallest cup, and I can get good suction here, and then just slide it along the edge of the IT band like that. Another way that cupping can be used is use it almost like a third hand. I can put a cup here right around her greater trochanter, just let it sit there and then do other work, and it can be like pin and stretch, where the cup holds the tissue as I'm working with my hands in other ways. Cupping can also be done with soft tissue release techniques. Say for the tibialis anterior, I'll use the smallest cup here because this is a smaller area on the calf. I can get a good suction and then work up tibialis anterior while pulling the tissues with the cup like this, so the muscle's getting stretched underneath as I'm working up the calf, and I can work back down too with the cup. One thing I like about the cupping, though, is that it does a lifting to the tissue, and it's like everything else with massage. We're pressing the tissues down in, and this works in a very different way by giving a lift to the tissues instead. You can also do cupping with soft tissue release on the quads. Here I'll ask Lisa to kick back and go back and forth like that, kicking back. So we're getting a nice stretch to the quads underneath, and I'm just sliding up her thigh with the cup like this as she's kicking back. And I'm moving when the muscle's stretching and stopping when it's contracting. And this is kind of lifting the skin off the muscle as the muscle's stretching. And it can be a little intense, but it works very well at releasing the superficial fascia.